Hello, I'm Dr. Joe Schneider, and I'm proud to do this video. Throughout the office, it's all you see is some great technology. This raises brain rehab to a whole new level that most practitioners can't achieve without it. The brain is the master control system of everything that goes on within your body. It relates to your experience and how resilient you are to stress and trauma over time. So we know that trauma affects our mental capabilities, it affects our emotional capabilities, and it'll affect our physical capabilities and how we relate to our world. Our technologies need to enhance and stimulate all those areas. So why are we so comprehensive? Because say you got in an accident, you flipped over, you hit another car, pretty complicated stuff. You got a brain injury and a neck injury and a low back injury. If you don't address everything, then you're going to get dismal results. You really need to have the necessary equipment to bring a patient like that along. After you've been in this business for so long, you understand how intricate it is and how complex injuries are. And we don't get patients right away after they've been injured. They go to insurance-based places. They come to us after they've been almost everywhere, and they're saying, I'm still suffering. Well, do I want to give you vanilla? You've got vanilla. Our rehab center that does not have the technology does not understand what it takes to get failed cases to turn around and get better. We know that when we do a functional medicine test and then we supply the necessary components or the fuel to the body, that the brain will get better. The gyrostim is right behind me. It is an FDA cleared device for breakthrough for vestibular and dizziness, but it does a lot of other things. It helps patients with Parkinson's, have movement disorders, visual problems, cognitive processing. Another therapy that we have is called neurofeedback. We do brain core neurofeedback to change the parameters to anything that we need for that patient. And we have a lot of experience with anxiety, depression, brain trauma, autism, ADHD, and different syndromes like that. We do interactive metronome. Interactive metronome is an easy therapy that has a rhythm and a beat to it. We do zirconia lasers for the brain. The best lasers on the market are used right here at our center. Now, anybody that says different are wrong. If you want to delve into that, just go to zirconia.com. You can delve into that a little bit more. We have an arc LED bed, which is a 5 wavelength, like a tanning bed, but it actually can process your body for inflammation, brain, viruses, infections, and things like that. Our vibration plate is harmonic. It's like standing on the head of a speaker. We can program different frequencies that are good for your body and rehabilitation. We do not do hyperbaric oxygen. We do oxygen with exercise. It gets areas of the brain functioning and asking for oxygen, and then we give it to it. Really do a lot of work. When people are not functioning right, they have POTS or dysautonomia. We do chiropractic care. I can adjust extremities, I can adjust the spine in a brain-specific way, and so that we can enhance our body to brain communication by doing those techniques. And then we have hydrogen therapy. So hydrogen can enhance you metabolically. And then we have decompression therapy for not only the neck, but the low back, for herniated discs, arthritis, and so forth. We have pulse electric magnetic field therapy that enhances mitochondrial function, muscle function, and it also enhances the stem cell capability in the bone marrow. We have other electrical stimulation that will anesthetize different nerves for different pain conditions. We have stem wave. Stem wave is a pulsed wave technology that will reduce pain, increase range of motion, and stimulate stem cells that are healing cells to go to the area and create changes or transformations in tissue. I've been there. I've had 3 concussions and I had a hemorrhagic stroke. For me to be here today doing what I'm doing, I had to have these technologies to assist me to get where I'm going. Now, some patients may come in and say, I only want neurofeedback. I don't want laser. I don't want this. Well, I can't treat you that way. So say you have an abnormal brain scan and I come up with 8 other critical areas of neurological weakness, then I have to address them all. And if I address them all, I get the results. If I don't, I don't get results either. So I have plenty of video testimonials, plenty of Google reviews. For most of our patients, we are a last resort. I may not have gone through as much as you have, but I've gone through a lot. And so that empathy and compassion is within our center on all levels. Thank God at our center we have that, and we're able to actually present that to the community so patients can get better and they can get their life back.